Hello, I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live Facebook discussion. I am here tonight with Dr. Thomas Farquhar. He's a radiologist here at Hartford Hospital. We are so happy to have you with us tonight. Thank you for being here. So we're talking about an exciting new piece of technology, and up-to-date. Technology's been around for some time, but an updated, new and improved, state-of-the-art PET CT scanner, which is creating a lot of buzz, and particularly for its low-dose technology. But first, before we get to that, let's talk about this new PET CT scanner. Kind of give us an overview of it.
So PET, as you mentioned, a PET CT scanner is a technology that's been around for a number of years, and we had a prior PET CT scanner, but it was time to get the latest technology in to be able to improve the pictures, lower radiation dose, and actually get more patients through the scanner each day to be able to provide better access to patients.
To get them through quicker, too. So let's talk about the lower dose technology, because I know when a lot of people, and when you're faced with having a PET CT image or any type of imaging, really one of the first questions always is, how much radiation am I going to be exposed to? So how does this lower dose technology work, yet still be effective?
Absolutely. So one of the things we do as radiologists is we try to use as low a radiation dose as possible. So the PET CT scanner is actually two separate scanners. You'll have a PET scanner and a CT scanner. So the CT scanner uses X-rays to generate anatomic images of the body. And the way that it's able to do it with modern technology and a modern CT scanner like the one that is installed in this PET CT scanner is to vary the number of X-rays to use only as many as they need to. It used to be more as a one-size-fits-all, and then whether the patient was larger or smaller, it would use the same amount. And even as it goes through different parts of the same patient's body, you're going to have parts of you that are thinner, like say your neck, parts that are thicker, say your shoulders. And in this way, as it's going through, actively doing the CT scan, it's adjusting for that. The PET camera also has some phenomenal new technology. It's a fully digital scanner, this current one. There's only about 24 of those that have been installed in the entire country. So there's no one who can say that they have a newer PET CT than we have at Hartford Hospital. And with that, it uses a 3D technique. It used to only collect data in 2 dimensions. Now it collects it in 3 dimensions. And with that, we're able to reduce the amount of radioisotope that we have to inject in patients, but yet still get phenomenal pictures.
Yeah, and it's extremely intuitive. Like you said, it sort of maps out, takes each patient as an individual, and will just inject the amount of radiation needed depending on what part of the body you're looking at.
Yeah, so the CT scanner will adjust as it's going through each different part of the body, and then we are also able to weight adjust it with the amount that we inject patients. So they're usually getting a fairly similar amount, but and then the scanner is able to collect that data, turn it into beautiful pictures.
Yeah, and beautiful clear pictures. So the accuracy and the precision in this compared to older models and other technology is quite a difference there.
Quite a bit, yep. They actually have, the technology is actually able now to differentiate between these photons of energy moving at literally the speed of light, and actually able to detect small differences in that. So when we talk about PET scanners and what you're able to see, we use a term called resolution, which is whether you're able to resolve or tell apart 2 closely adjacent objects. And we basically have seen that improve by a factor of 2, so that the objects are about half as close now as what they used to be on the old scanner, still able to tell them apart. So whether that's a smaller cancer or an abnormality that we see sooner, we're able to generate better pictures and help the physicians to help their patients.
In case you're just joining us, we are talking with Dr. Thomas Farquhar. He's a radiologist right here at Hartford Hospital, and we're talking about a new state-of-the-art updated version of PET CT scanner in Hartford Hospital, one of the first, only a handful in the country, certainly first right here in Connecticut. If you certainly have a question for Dr. Farquhar, we encourage you to ask him anything about radiology or about this new PET CT scanner. I'm sure you're happy to talk about that. The benefits of this new scanner, we talked about accuracy, precision, we talked about the lower dose technology. How, aside from all of that and clearer pictures, is it quicker for you to interpret images now? What are the benefits for you as a radiologist?
So a lot of what you'll be able to do is you can say things with more confidence. So if you're able to see more clearly, then you're able to be more confident that this is either normal or abnormal, and you're able to, that something is changed for the better or gotten worse. And that's a lot of what we're able to see. The pictures the difference in the quality in the images to us, it's going to be how sure we are as we're able to deliver an answer.
Yeah, and I'm sure as a physician, you're more just having that confidence and being armed with that confidence when you go back to the patient and say, you know, I can say with, you know, certainty, these
Definitely
are the
better,
results.
yeah. Right, that your treatment is definitely working and we're seeing noticeable improvement. Those are the types of things that we want to be able to see and see it more quickly.
And I'm sure for patients, because obviously, you know, the one thing on your mind really is that radiation factors, that people are always so scared to have imaging, and especially if you have to have imaging multiple times, then you're being exposed to, you know, even greater amounts. So having something like this kind of cuts that down pretty significantly.
So most physicians and radiologists in particular are always looking to make sure that we're using the radiation appropriately and using as little as reasonably possible, but yet still being able to provide the information that the treating physician needs. And this is just one more part of that. So we're thinking about it in all of the different types of tests that we use, our other CT scanners and things like that. And then this is just another way we're addressing that, because we have the same concerns that patients do, that we want to make sure that we use radiation as judiciously as we can.
Yeah, absolutely. What should patients be asking? What should they be, what should they know? What do you want them to know?
So the patients should be asking where they can have their studies done with the latest technology, and they want to make sure that they have physicians who have the great wealth of expertise in interpreting these images, so that they're able to get the answers that they need. And then another thing to know is most of what the first applications for PET-CT were for cancer. But we actually use it for other things. It can be used to localize epilepsy in the brain. Another one is that it can be used to make an earlier diagnosis in appropriately chosen patients of Alzheimer's disease. So we have a number of different tracers that we'd use, each one looking at a different type of metabolism in the body that we can help in different things.
Yeah,
it's not just all oncology.
Yeah, I was going to ask you, when you're talking about Alzheimer's and when you're looking for that, how specifically, with the PET-CT scanner, how do you actually decipher that?
Sure.
And how do you see that, and what do you
So the amazing part about most of what we do in radiology is anatomic imaging, where we're just taking pictures of the structures in the body. But nuclear medicine, in this case PET, or positron emission tomography, it's actually amazing because what it's looking at is metabolism, the physiology of your body and the changes that occur with your physiology in different disease states. So depending on what molecule we go ahead and we inject, we can follow different types of metabolism. So most of what they use is an analog of sugar. Sugar is taken up in cancers that are growing faster and use it more exclusively. But the particular isotope that we use for Alzheimer's is shown to be a target or a flag for that type of disease. And so that opens up an entire array of different things that we can look for.
And I would imagine with the accuracy and precision of this PET-CT scanner, you can really zero in on that more so than you probably could before.
Absolutely. And again, to make decisions and diagnoses with greater confidence or perhaps at an earlier time.
Absolutely. We have a great question from Lynn here. She wants to know if this might be safer or safe at all for pregnant women. Lynn, thanks for that question.
Oh, that's a great question, Lynn. So generally speaking, we would not be injecting that in a pregnant woman. There would be a CT scan maybe, but the PET scan we would be concerned about. It would be a question to ask your physician. We would really want to weigh the risks and the benefits of that for someone who is pregnant.
Even though it is a lower dose radiation.
Absolutely.
Still, right.
Pregnancy is a special time,
and
we take extraordinary caution about radiation during pregnancy.
Aside from pregnant women, is there any other population that could not have a PET-CT scan?
No, I mean, generally speaking, you'd need to be able to lie flat and fit in the scanner, and other than that, if it's an appropriate indication for it, there's a few other reasons why not to. So.
Yeah. How have the patients responded to having this new piece of technology when you go and say, hey, we can do this, but you're going to get
It's a wonderful setting. They renovated
dose.
part of the nuclear medicine lab as well, and I'm sure that the patients appreciate the fact that it is a quicker experience.
Yeah.
So it used to, for example, They acquire it at multiple different stops or bed positions. It used to take 4 minutes for each of these. It's now down to 2.5 minutes.
Wow.
So the patients are on the scanner and off the
Yeah.
scanner much more quickly,
Right.
and the pictures are better. So it's a real win.
I was going to say it's a win-win all the way around, and it's, you know, the last thing you want to do is just lie on that table completely still for 4 minutes. That's a long time, and you know, people get antsy. So that's another good feature. Beth asks, what conditions would lead to being scanned by this machine? Thanks, Beth, for that
Thanks, Beth.
question.
So there's, it is widely used mostly in oncology now. So almost most cancers that you can think of, they'll often get a PET-CT at the time of diagnosis, and then often the team that's treating the patient, they go ahead and get a follow-up PET-CT at another point to make sure that their treatment is working. And they can use that as an early signpost to see that they're kind of beating the cancer and decide whether or not they need to change their strategy or not.
Yep.
But there's a wide range of cancers that it's quite commonly used for.
And is that this particular model, or is that all that kind of
PET-CT
runs
in general,
PET-CT in general?
PET-CT in general, from lung cancer to different types of breast cancer, lymphoma, all sorts of different types of cancers. It's widely used.
Kind of explain generically, some people call it CAT scanner, CT, PET-CT. Just kind of explain the difference for folks out there,
Sure.
what it is that you're talking about when you say PET-CT or just CT, or sometimes you hear CAT scan.
So CT just stands for, it's computed tomography. Tomography is the process of taking the pictures that we can then look into little slices, so that it gives the 3D look at everyone. And so that T, or the tomography, ends up in all these different names. So it used to be called a CAT scanner, and they got rid of the A and just call it a CT scanner now. So that the PET scanner is actually, it has a full CT scanner, and then that bed slides the patient right into the PET camera. PET stands for positron emission tomography. It's actually a pretty amazing, a positron is the antimatter version of an electron. So it's actual medical use of antimatter, which is kind of, sounds like Star Trek, but it's actually real. So the isotope is a positron emitter, and then that T is tomography. So again, we're able to get pictures like slicing a person like a loaf of bread, and we're able to look at someone in 3 dimensions that way. So all of those different things, and that's use that same word, and that's why it ends up as that alphabet soup. But
Yeah, and I'm sure for you as a radiologist to interpret these images, it's probably so much easier for you now, right? Would you say, in terms of breaking down all of those slices, and because it's so much accurate?
Yeah, so we have a information explosion, so we're actually able to get a lot of different images in a lot of different directions. They go front to back, side to side, and all the way through. And so we actually use newer computers to be able to handle all of the different information that we have, so that we're able to synthesize it, look through it, and then come to our conclusions.
I mean, and this is pretty leading edge. I mean, it's right at the forefront, right there. It's brand new technology. Where do you see this going? Where do you see the technology going?
So the technology right now, there's probably some physical limitations where this is pretty close to as good as the technology you'll get. The exciting thing in nuclear medicine, in my field in general, is they can use these different molecules, different chemicals, to target different types of diseases or to go to different places in the body and reflect the metabolism. It's not just looking at the structure of the body, but it's actually looking at the function of it. And for that, there's a whole range of things, and the world is really wide open from that perspective for what you would be able to take pictures of using a scanner like this.
It's pretty remarkable, and I'm sure you've seen, obviously, the change in terms of, we had the very first model here in Connecticut that was just replaced with this newer model.
Correct.
But I'm sure for you as a radiologist has seen a significant difference between the two in terms of imaging.
Oh my gosh, yes. The pictures are night and day between the two. And then, as I mentioned, it used to be, back 10, 15 years ago, they just used one particular isotope.
Right.
Now we see a greater number of uses for it, uses that they never had thought of, and we're also now seeing these other different things. So it's now almost a pharmaceutical chemistry problem as they're looking at everything on a molecular level.
Yeah,
it's very exciting.
Interesting. And then when you talk about precision medicine, I mean, you talk about precision medicine in oncology in terms of immunotherapy.
Absolutely.
And targeting tumors precisely. This is almost along the same lines.
This is the radiology imaging version of that same thing. Absolutely.
Right. And I don't think people realize that with imaging, it's definitely a science, and you have to have that experience to be able to interpret the results too. That's a lot of it too.
It is.
Right?
Yeah, it is. And so we enjoy being part of a team, part of the team of doctors that are helping to figure out whether the treatment is working or what the next right step is. And we do that through the tools that we have to image the human body.
Yeah, Dr. Farquhar, thank you so much.
My
This has
pleasure.
been really eye-opening, and it's been
Thank
a
you.
terrific topic to talk about. So we thank you for sharing your expertise and
Thank
your
you.
time with us tonight.
My pleasure.
And of course, we thank you for sharing your time with us and the great questions that you asked Dr. Farquhar. And so if you have any questions or if you would like more information, you can call 1-855-HHC-HERE to learn more about this new PET-CT scanner here at Hartford Hospital. Thanks again for sharing your time with us. I'm Hartford Healthcare's Tina Verona. We'll see you next time.